Our bodies move in 3 different planes around 3 different axes. The sagittal plane moves around the frontal axis, producing flexion and extension. The frontal plane moves around the sagittal axis, producing abduction and adduction. The transverse plane moves around the vertical axis, producing rotation. The shoulder girdle motions consist of elevation, depression, upward rotation, downward rotation, protraction, retraction, and in some cases, scapular tilt. The shoulder joint is a ball and socket joint with motions including abduction, adduction, flexion, extension, hyperextension, lateral rotation, medial rotation, horizontal abduction, horizontal adduction.
The elbow is a hinge joint with motions being flexion and extension. The forearm produces pronation and supination as the motions. The wrist is a condyloid joint. Its motions include flexion, extension, ulnar deviation, radial deviation. The thumb is a saddle joint. Its motions include opposition, reposition, flexion, extension, adduction, and abduction.
Guys, I'm ready. I'm dressed, I'm ready to go. All right, here's your stick. All right, here's your face to mask. Okay.
Now we're just going to break down the motions that you need to learn to be a lacrosse player like us.
Okay. All right, let's go.
Word. Phase 1.
Holding lacrosse stick in neutral stance with ball.
The shoulder girdle is producing elevation, which is an isometric contraction of the trapezius, levator scapula, and the rhomboids. The shoulder joint is producing extension, which is a concentric contraction of the posterior deltoid, latissimus dorsi, teres major, pectoralis major. The elbow is producing flexion, which is a concentric contraction of the triceps brachii. The forearm is producing pronation, which is a concentric contraction of pronator teres and pronator quadratus. The wrist is in a neutral position, which is an isometric contraction. The thumb is producing adduction, which is an isometric contraction of adductor pollicis, and this stays the same phase 1 through phase 4. The fingers are producing flexion, which is an isometric contraction of the flexor digitorum superficialis, flexor digitorum profundus, and the lumbricals.
Phase 2.
In phase 2, the shoulder girdle is producing retraction, which is a concentric contraction of the rhomboids and the trapezius. The shoulder joint is producing adduction, which is a concentric contraction of the deltoid and the supraspinatus. The elbow is producing flexion, which is a concentric contraction of the biceps, brachialis, and brachioradialis. The forearm is producing pronation, which is a concentric contraction using pronator teres and pronator quadratus. The wrist is an extension, which is a concentric contraction of the extensor carpi radialis longus, extensor carpi brevis, extensor carpi ulnaris. The thumb is producing adduction, which is a concentric contraction of adductor pollicis, and the fingers are producing flexion, which is a concentric contraction of the flexor digitorum superficialis, flexor digitorum profundus, and the lumbricals.
Phase 3.
For phase 3, the shoulder girdle is producing protraction, which is a concentric contraction of the serratus anterior and the pec minor. The shoulder joint is producing flexion, which is a concentric contraction of the anterior deltoid and pec major. The elbow is producing extension, which is a concentric contraction of the triceps. The forearm is producing pronation, which is a concentric contraction of pronator teres and pronator quadratus. The wrist is producing ulnar deviation, which is a concentric contraction of flexor carpi ulnaris and extensor carpi ulnaris. The thumb is producing adduction, which is a concentric contraction of adductor pollicis brevis. The fingers are producing flexion, which is a concentric contraction of the lumbricals and the flexor digitorum superficialis and flexor digitorum profundus.
Phase 4.
Phase 4, the shoulder girdle, is in protraction, which is a concentric contraction of serratus anterior and pectoralis minor. The shoulder joint is in medial rotation and adduction, and it's a concentric contraction of latissimus dorsi, teres major, and subscapularis. The elbow is in flexion, which is a concentric contraction of flexor carpi radialis and flexor carpi ulnaris. The forearm is in supination, which is a concentric contraction of the supinator. The wrist is in flexion, and it's a concentric contraction of flexor carpi radialis and flexor carpi ulnaris. The thumb is in opposition and adduction, and that's a concentric contraction of adductor pollicis longus and opponus pollicis. The fingers are in flexion, which is an isometric contraction of the lumbricals and the flexor profundus.
Hey Rick, show us what you got.
Get it, girl!
Hey! Woo!
No, honey, I'm good. I could have another, but I probably should not.
The frontal plane moves around the sagittal axis, producing abduction and adduction, hyperextension, lateral rotation, horizontal abduction, horizontal adduction. And you guys did opposite things.
Baby's already got all of my love. So no, I'm good. I can have another, but I probably should not. I got somebody at home, and if I stay, I might not leave.